Hello and welcome to our brief presentation entitled What You Need to Know About the Affordable Care Act. In March 2010, President Obama signed into law the Patient Protection and Affordable Care Act. We now call it the Affordable Care Act, and it's sometimes referred to as Obamacare. This 6-minute presentation will answer 9 questions that you may have about the Affordable Care Act. It's provided by Fair Insurance Services, a family-owned and operated business since 2004. Question number 1. Am I required to buy personal health insurance coverage? Yes. Effective January 1, 2014, all citizens and legally present individuals must either purchase personal health insurance coverage or will have to pay a penalty when they file their 2014 income tax. A few individuals are excluded from this mandate, and if your employer provides essential health benefits coverage through work, you will not be required to purchase an individual policy. Otherwise, you'll be required to obtain coverage for yourself and your dependents or pay a penalty. Question number 2. How much will this cost me? Well, the cost of a health insurance policy will vary by a person's age, location, dependent status, and the benefit plan in which they enroll. There are 4 plans available: Platinum, Gold, Silver, and Bronze. All of these plans must provide essential benefit coverage for things such as doctor office visits, prescription drugs, hospital services, and other medically necessary services and supplies. As in the past, these plans will feature various deductibles and co-payments based on their metal tier. The rates for these plans are now available online through the Health Insurance Exchange. Question number 3. What is a health insurance exchange? Well, a big part of the Affordable Care Act requires that each state set up an insurance exchange or marketplace. These are public entities that have negotiated rates and benefits with various health plans and insurers. In California, the exchange is called Covered California, and it features several health plans, including, here in the Sacramento area, Anthem Blue Cross, Blue Shield of California, Kaiser Permanente, and Western Health Advantage. All of these qualified health plans will feature the new metal benefit plans, Platinum, Gold, Silver, and Bronze, and will work through local insurance professionals called Certified Insurance Agents. Question number 4. What if I can't afford to buy health insurance? Well, the Affordable Care Act provides a health insurance premium subsidy for qualified persons based on their annual income. For example, an individual earning between $15,856 and $45,960 per year can receive all or part of a premium subsidy. For a family of 4, this income level range is between $32,499 and $94,200 per year. In order to obtain this premium subsidy, they will need to apply for coverage through the insurance exchange and provide proof of annual income. Obviously, the lower a person's income, the greater the subsidy they can receive to pay their health insurance premium throughout the year. Question number 5. But what if my family income falls below this minimum? Again, as part of the Affordable Care Act, the state of California is expanding its program for the poor. It's called Medi-Cal. This program includes no-cost coverage for individuals and families whose income is below 138% of the federal poverty level. Previously, this was available only to families with children whose income was below 100% of the federal poverty level. The expanded Medi-Cal program will now be available to individuals without children and will now feature coverage options from private carriers including Anthem Blue Cross and Blue Shield of California. Question number 6. Can I be turned down for coverage? Well, in the past, individuals were medically underwritten and could be turned down for coverage due to a pre-existing health condition. However, under the Affordable Care Act, you cannot be turned down for coverage if you enroll during the annual open enrollment period. The initial open enrollment period began October 1, 2013 and will run through March 31, 2014 for effective dates beginning January 1, 2014. Future open enrollment periods will take place between October 15th and December 7th of each year. You will not be able to enroll for coverage outside of an open enrollment period except due to special circumstances. Question number 7. Are pre-existing conditions covered? Yes, they are. In fact, health insurance applications will no longer ask questions about your medical conditions. But you must enroll during the annual open enrollment period for your coverage to take effect. Otherwise, you will have to wait until the next annual open enrollment period. Question number 8. My employer provides coverage for me but not for my dependents. Can I just get coverage for my dependents only? Yes, you can, but you will need to apply during the annual open enrollment period for dependents that are not enrolled through the workplace. The federal premium subsidy may be available for them depending on their eligibility for coverage through your job. You will need to go to the insurance exchange to have them make that determination, or talk to a certified insurance agent who can walk you through that process before you apply for coverage. Question number 9. How do I enroll for coverage? The enrollment process is a bit tricky and can be done online or using paper. Either way, it's helpful to have someone who can sit down with you one-on-one, either in person or telephonically. A typical one-on-one enrollment meeting will take 30 to 45 minutes depending on family size. You will need to provide personal information about yourself and your dependents, including name, address, phone, and Social Security number, and a place of employment. To qualify for the premium subsidy, you will need to provide proof of income such as a prior year tax return, paycheck stubs, or similar information. For personalized service, you can contact Fear Insurance Services at our toll-free number between the hours of 8 a.m. and 6 p.m. Monday through Friday to schedule either an in-person or telephonic appointment. So, we hope this information has been helpful. There is no easy way to explain the complexity of the Affordable Care Act, and we're sure that you may have additional questions. There are many other parts of the Act that affect employers and their employees. So give us a call at 877-663-3273 or stop by our office and we'll sit down with you and answer all of your questions. We've spent a great deal of time to become certified in the Patient Protection and Affordable Care Act, as well as to become a certified insurance agent for Covered California. We work with hundreds of clients to help them purchase the right kind of health insurance at the right cost. Let our family help you to work through the new health insurance market that has been created by the Affordable Care Act. Thanks and have a great day.